All right, everybody, welcome back to another episode of Honestly Bilal. My name is Bilal Men, and I'm a fourth-year medical student at the University of Toledo. And this is Honestly Bilal, the show for the aspiring ophthalmologist, where I sit down and talk to medical students who are interested in ophthalmology. I talk to residents training in ophthalmology, and if I'm lucky, I sit down with ophthalmologists in the field today. My guest today is Dr. Tom Oetting. Dr. Oetting is the Ophthalmology Residency Program Director at the University of Iowa, a consistently top-ranked residency program. He is also the Rodolfo and Perez Jr. and Margaret Perez Professor in Ophthalmology at the University of Iowa, the Deputy Director of the VA, and a Clinical Professor of Ophthalmology. Dr. Oetting, it's a pleasure to be with you. Can't wait to talk about Iowa and hear more about what's going on down there.
Hey, thank you so much. You know, I'm really excited with what you're doing. I love the idea of trying to connect using the technology we have, and I guess it's the technology that we've sort of gotten thrown into with this whole COVID deal. And you're one of the people that have really done a good job of making the best of a bad situation. Well, as you mentioned, I've been at the University of Iowa a long time. Love it here in Iowa. I kind of stumbled on the Midwest after growing up in Alabama, and then went to school and grad school and med school in at Duke. And so this was a reach for me to get up here to Iowa. I was kind of nervous about it. It just really stuck, and I've loved it here, and love the opportunity to talk a little bit about Iowa in general and our program in specific. My background is maybe a little different than typical, because I was in the Air Force right after college. The Air Force paid for my undergraduate training in engineering, and so I worked for 4 years on active duty in the Air Force, and another 4 or so years in the reserves, and was doing engineering work. We had some cool projects that we worked on, like GPS and jam-resistant communication, stuff like that, but really nothing to do with ophthalmology. And then I was in grad school in engineering, and my wife was a medical student. And I kept getting real interested in all the stuff she was doing. It just seemed more interesting than what I was doing. And so I just switched over about halfway through my PhD in engineering over to med school, and I've really been glad I did it. I have found that ophthalmology satisfies a lot of the technology sort of itches that we all have. I'm sure that's one of the reasons you're attracted to it as well. It's just there's so much cool technology. And I think, and then there's these really cool patient interactions that make it really satisfying. So so my background's a little different, because I was an older student, and I was in those days it was more unusual. There's a lot of people going from engineering into ophthalmology now, but it's kind of unusual.
Sure.
And I started off in general ophthalmology. I didn't do a fellowship. I thought a little bit about pediatric ophthalmology, and I decided to stay in general ophthalmology. I worked briefly in private practice, and I, as a veteran, I was always really interested in the VA. I thought the VA could be better in Iowa City and in general, and so I sort of took it as a mission to come back to Iowa City and try to make our VA as good as possible. And so we really developed that VA. We put in a little simulation center years ago to help people with develop surgical training skills. That's still very, very active. We brought all the subspecialties into our VA, and so that was my main focus, was the VA. And then I think because I got interested in sort of the idea of structured training for surgery, I got a little bit of bug to do the education work, and then eventually became the program director, and have done that for like, I don't know, a long time. Too long. I don't want to talk about it.
We won't age you.
Time. So that's kind of my little gig. The thing I like about this year is we've been thinking about doing virtual recruiting forever.
Sure.
And from our point of view in Iowa, we sometimes have very scary years where we'll be planning on some interview in December, and some storm comes rolling through Chicago, and it's a disaster, right?
Yeah.
And you know, I get to know our students really well, and I know they're spending, you know, $5,000, $10,000 on these interviews.
For sure.
And you know, they put on a good show, but it's stressful.
Yeah.
And it's hard, and it's very, very programocentric. It's very, it's hard to hide that.
Hmm.
And so we've been thinking about doing virtual interviews forever. But I mean, honestly, I didn't know how cool Zoom was until about 3 months ago.
Right. Same here. Yeah.
I mean, why didn't we buy stock in Zoom?
No.
Ridiculous. I actually did try to buy stock in Zoom, but there's some company that's called Zoom. It's not the right company.
Oh, the wrong one. Oh no.
Yeah, if you look up Zoom stock, you'll see there's a Zoom that's not the right Zoom. But anyway, why we didn't buy stock in Zoom and who knows? But anyway, so I didn't. But the ability to use Zoom
Hmm.
that we learned from all these webinars and stuff,
Yeah.
and including your webinar that you put
Yeah.
on, where when we first met, has taught me that I think we can do this virtual interview okay. I think it's going to be okay. It's
Yeah.
not going to be quite as good, but it's going to be okay.
Mhm.
And I think from the point of view of you as someone interviewing,
Sure.
it's not going to be that bad. You're going to save a lot of money. It's going to be less stressful.
Mhm.
You're not going to have to come in without your suit because you didn't have, your bag didn't make it or
Right.
whatever. There's all these ridiculous decisions. We had people that would like have an interview in Madison on Thursday and then drive all night and come to Iowa City on Friday. Just these ridiculous stories, and they look good, they're looking.
Yeah. Yeah. Yeah.
But it's anyway. So I don't think it's that bad. I think it's an opportunity for us to try,
Hmm.
and it's an opportunity for us to try without risking everybody else not doing it.
Yeah.
So if we were just going to try virtual interviews on our own in Iowa, it would be like, whoa, really risky.
Right.
What is Iowa covering up, right? They're trying to cover.
What do they have?
And so this allows us to try this and see if we like it. And maybe we will, maybe we won't. I don't know.
Right.
Anyway, so that's kind of I guess how you and I first met was because we were thinking about and worried about this whole virtual thing.
Hmm.
I think the thing about Iowa that's tricky is our best thing, I think.
Hmm.
Well, our number one best thing is our patients. By far, that's our best thing.
Sure.
And what do I mean by that? Well, we're like the only show in a huge region,
Hmm.
and we are the University of Iowa.
Right.
And so everybody from Iowa that comes there knows that we're a good ophthalmology program.
Hmm.
It's their program.
Sure.
It's not like there's a bunch of competition. So when they come to our program and they see a resident, it's their resident because it's their program.
Sure.
It's a very different sort of attitude. And one of the important things when you're learning is you want the patients to be part of this deal.
Yeah.
You can't escape that.
Right.
You can put your head in the sand a little bit, but fundamentally, these patients are letting us learn on them.
Sure.
And it's something that, to be honest with you, I didn't even want to think about as a resident because it's too harsh to think that the truth, the real reality is these people are accepting risk so that I can become a better surgeon or whatever. But the great thing about our patients is that they're all bought into this. Mm-hmm. And so honestly, when I'm in clinic, like tomorrow, Chris and I are in clinic, mm-hmm. and if I go busting in to a room ahead of Chris, and they've seen Chris before, they're going to be like, whoa,
yeah,
where's that Chris guy? I want to see him because he seemed to really know what was going on.
Sure.
He's really good. And when we ask patients, our normal thing is for Chris to do your surgery, and I'll be right there with him.
Right. Very
rare when they say no. Mm. And so that's our real secret weapon, and I think it comes from the fact that that we are a source of pride for our patients that come from all over the state. Mm-hmm. I think the second thing that we're really proud of is our residents and our alumni. Mm-hmm. That's hard to show you. I mean, we're gonna if you interview with us, we're gonna show you some videos of alumni. We're gonna show you some cool places where they've gone. And we're gonna show you some videos of things and stuff. But what's hard to show is the real feeling that everything's okay. Mm-hmm. We're not hiding anything. We're not keeping 2 or 3 residents in the back locked up that can't come out, because
in the freezer,
their problems, or they don't like us or whatever.
Right.
And so that's the only thing that's going to be slightly harder to prove to you.
Sure.
But because when you come in a live interview, for example, you get off the plane,
Mm-hmm.
and people in the airport know about us,
Uh-huh.
and you get on the little van that takes you to our department, and the guy driving you probably knows me because we've been on so many trips together, right? And he says, yeah,
Sure.
yeah, I know that guy, he's kind of fat. He gets up real early. He's always trying, and so that's kind of a cool thing because it makes because we don't really want to hide anything, but it gives you some confidence that we're not hiding anything.
Mm-hmm.
Um, and then the little town of Iowa City is a cool Midwestern college town.
Mm-hmm.
But this year, I don't know if it's going to be a cool Midwestern college town or not. There may be no football.
Yeah.
I don't know if there's going to be any students,
Uh-huh.
So it's a weird year. But next year, when you guys start, by then we'll all have wonderful vaccination scars.
Hopefully, yes.
Who knows? But I'm counting on it. And so we're going to be going to football games. We're going to be enjoying the culture of a Midwestern town.
Yep.
And because it's a Midwestern college town, it's got restaurants. It's got a cool feel. It's got stuff to do. It's got cultural activities and stuff.
Sure.
It's so it's not as big as via Ohio State, where you're just with Andy, I guess.
Yeah.
But it's like a 1/10 scale model
That's fair.
of Columbus, Ohio. But so anyway, I think those are the things that I'm slightly nervous about, is that we can't properly show you the cool residents we have and the culture we have. We can't properly show you the city. We're going to try to also give you some sense of what our faculty are doing.
Okay.
Our faculty are really cool, and the only reason they come to our program is because they want to teach. I mean,
sure.
You can make a lot more money in other places, and you can have fellowships and stuff in other places. But the thing that we've always prided ourselves on is our residency program. Mm-hmm. And so that's why they're here, and they really enjoy working with our residents, and so that's another thing we want to try to get across to people when they come here. We have 2 VA hospitals.
Wow.
that we can send our people to.
Mm-hmm.
And that's a nice thing. I think when you're looking at residency programs, you want to ask yourself if there's a place or 2 you can go to that's different, that gives you a different sort of idea of how to care for people.
Yep.
So our VA and both our VAs really are very innovative. For example,
Mm-hmm.
we do bilateral surgery same day.
Oh, wow.
We do a lot of innovative stuff that you can do in a non-fee-for-service environment.
Huh.
We have a great director of our VA in Des Moines who's very innovative, tries all the latest lenses and tries all the latest eye stent-like devices,
sure.
MIGS devices. And we do a lot of those in our Iowa City VA too. So it gives you, because of the non-fee-for-service model, and because of the ability to sort of more quickly innovate without worries of cost. VAs have become a really important source of training. Mm-hmm. And so I think you might want to think about that a little bit. There's other ways you can do that though. There's county hospitals, there's institutes, there's other ways that you can get different exposures. But I think it's nice to go to a couple different places to get some different views, different angles on things. So yeah, our program is looking forward to this cycle. We'll see how it goes. I'm looking for advice, to be honest with you. If you have any advice, or I'll be watching your show to see
Sure.
deeper advice, because I want to figure out what you want, or what our applicants want. When you do a virtual interview.
Well, I think the one thing I've noticed from my guests who've been on the show, that most people have the same consequential fear of what is going to be the culture of the program. How do the residents get along there? Is there a team-based environment? Is there a place where I can go to where, if I'm on call, somebody can have my back, or can I be there if I'm busy in clinic and somebody help me out and, cover the workload too, and we can do it together. I think that's something that, it's not just, it's common sense, but it's also something that I think a lot of us are wondering how you're going to get that sense when you go to a program, if it's virtual or not. So how about you touch on that? What's the culture and the vibe at Iowa? What do the residents do when they're together? Is there that family feel, or what do you like about the residents who you have right now?
Well, we have 20 residents. We have 5 per year for 4 years. We have it's a internship that is run by internal medicine, and then 3 years that we have. One of the things we really emphasize with the 5 as they come in each year is how important it is to get tight.
Sure.
And I think it's really true wherever you go. I think it's important to make that a high priority. And so in other words, don't worry about a couple of extra calls here or there. Don't worry about not getting exactly the right clinic you wanted first. By far the most important thing is to have a tight class.
Right.
It's important for several reasons. One reason it's important is somebody probably in your class is going to have a problem.
Mm-hmm.
They're going to have a health problem. They're going to have a parent with a health problem. They're going to have a baby. They're going to have something.
Yeah.
And so the best insurance you can have for that working out okay is to be a tight class. And so that's one reason to be a tight class. The other reason is it's all the fun, right? I mean, the fun is being a tight class. And so what you want to do is when you graduate, you want it to be like, oh my God, these people I'm going to be in touch with forever.
Right.
And not only the people in the class that you're with, but the people a little bit ahead of you, a little bit behind you. And what that does is it gives you exposure to a lot of people if you think about it. So when you start as an intern, there's 15 people ahead of you, and then when you there's 15 ahead of you, and plus your own 5, and then when you finish as a chief, there's 15 below you and your own 5. So there's like 40 people or so, and then all the fellows that you get tight with.
Yeah.
And so at least in our program, you have a very good beginning network. Mm-hmm. For the rest of your career, and then all those people are going to spread out all over.
Sure.
And so there's very little that's more important for your long-term enjoyment in ophthalmology than a network.
Sure.
Right? That's what really makes it fun, and it makes it fun in some ways because your network is what allows you to continue learning in a safe way and a comfortable way later. It's also fun because your network makes the meetings more fun. It makes the I'm going to try something. What should I do? And then there's going to be somebody in your class that's a more of an early adopter in some technology than you, and you're going to talk to them about it. And so that part of it is really important. And so we really, really emphasize that.
Okay.
From day one, I say this is important. You're one class. You're not. You try not to be 5 individuals, you're one class, you work tightly together. And we have had some issues, like every program, with health or other issues. Mm-hmm. And we have worked together, and it's brought people tighter and tighter. And some of the tightest classes we've had are the ones that had the most problems.
Yeah.
With health or whatever. And so that's the thing I think to remember is no matter where you are in training to get tight with your class. Now, there's some programs that are smaller, 2 or 3 people. Mm-hmm. And so you want to get tight with, the other classes and stuff. And there's some programs that are huge, that have like 10 people, and you may not be able to get that whole as broad as that. I also really like the internship as an opportunity to sort of get exposure to a broader network.
Okay.
And so, our internship's a great way for our residents to get to know the ER doctors, the internists, a lot of the other subspecialties. And selfishly, from my point of view, like if I want to get somebody in rheumatology, it's just like nearly impossible before we have the internship. We can always slip them in somehow,
That's true.
And so that's really good.
Right.
But but I think more importantly, it gives people perspective. It seems less lonely at night when you're on call.
Yeah.
One of the crummy things about ophthalmology is a lot of times there's just one ophthalmologist.
Sure.
Oh. And your internal medicine colleagues, there's like 15 of them on call, and they're all like, playing ping pong together or whatever.
Right.
and so the you know, the ophthalmologist is kind of on his own
Mm.
until there's enough of a problem for more to come in. We have plenty more people that can come in and help if you need to, but in general, it's just you.
Yeah.
And so that knowing some of those people that you learn as an intern can make that much more fun and interesting and fruitful.
Yeah.
So, but anyway, I think when you're looking at programs, just try to get a sense for how often they hang out together.
Yeah. Yeah.
You know, are there events that the department has that make it easier? The COVID thing has made it tricky
Mm.
because officially there's no parties, but man, I'll tell you that there was some rule busting going on, especially with our last chief class. You
I
know,
won't tell anybody. Yeah.
their definition of the bubble was vague.
That's fine. Their senioritis kicked in.
But you know, I think the truth of the matter is that they did spend a lot of time together here, and so I think once the COVID thing's over, you know, the getting together somehow is very useful.
Sure.
And I think it's important when the seas are calm
Mm-hmm.
to develop relationships.
Yep.
So in the middle of a storm, when crazy things are happening, it's hard to call on your buddy that you don't really know.
Right.
But when the seas were calm
Mm-hmm.
and you went out with them and you met her husband,
Uh-huh.
met her kids, you heard about her hopes and dreams when
Right.
the seas were calm.
Mm-hmm.
Then when the seas get rough,
Mm-hmm.
you'll do anything for them.
Sure.
And I think the same is true to a certain extent for the fellows and for the faculty. So that's what you want to try to figure out. And then, you know, there's very few caustic learning environments, really. There's not that many anymore like there used to be. But you want to, you know, make sure that people respect your time. One of the things we do at Iowa, which I really like that, but I like it because it was my idea.
That's fine. You can endorse yourself here. That's fine.
So I just want to be clear about that. But because it's biased. But one of the things that's always bothered me about medical education is that there is this feeling like you're supposed to be this amazing, wonderful person that's so rich and varied,
Yep.
like you are.
No, that's not.
And then we want you to come in the program and we want to stamp you into a mold that's exactly the same as everybody else,
Sure.
right?
Mm-hmm.
And so we want you to read these exact same things and we want you to do these exact same things.
Right.
So that sort of process always bothered me as an older, more formed person going into the process because, you know, I had opinions and stuff.
Mm-hmm.
And so I think one of the things we've tried to do to stop that is to give everybody a half day every other week. And we call it captain of your ship time.
Oh, it's awesome.
And basically the idea is that we all want you to take that time and you do what you want with it. So, you know, you're a big boy, you're a big girl, whatever.
Yeah.
You know where your holes are in your education.
Right.
You have interesting ideas. You may need to go to the gym. I don't know.
Yeah.
You may need to go to a counselor.
Sure.
I don't know.
Mm-hmm.
But you use that time in the way that's best for you because we respect your ability to make that decision.
Wow.
And so that's something we started a few years ago, and it's been amazing what people have done with that time. Some people have just, you know, been stressed and you know, did push-ups or went to the counselor or something. Some people did these long projects on QI. Daniel Trevine, Daniel Trevine would be a good one to get on this show. Daniel Trevine, who was one of our residents who graduated about a year and a half ago, he did these wonderful QI projects at the VA, and the fruit of that was us doing bilateral cases at the VA.
Oh, okay.
We've had people that have done long research projects, you know, like if you do a lab research project,
Sure.
if you have a half day off every other week, you can go into the lab and do a project. You can have these long projects that involve consultations. So Brittany Scruggs did a project like that. We just had a really cool project that got a lot of press on Twitter with Lauren Hawk.
Okay.
And basically what she did was a really cool project looking at patient-based sexual harassment,
Mm,
which is a humongous problem, much bigger than you
sure.
think.
Sure.
And so, this is patients hassling our residents in some, in some weird way.
Yeah.
And so, but that project required a lot of collaboration with, other departments, the diversity office, psychology, that kind of stuff.
Mhm.
And so, those sort of projects that take a while, if you just have a research block that's like, 6 weeks research block, take
Mhm.
all your vacation during the research block. So
Uh-huh.
you end up having a 2-week research block, right?
Right.
If you have that in your program, you can't do these long projects.
Mm.
And so she was able to do a long project. The other useful thing about this captainship time
Mhm.
is, let's say that you miss like 4 weeks of a rotation because you had a baby or something,
Okay.
and you want to make up that time. So for the next 2 or 3 rotations, you use your captainship time and you come back and make it up.
Gotcha. Okay. Wow.
So it's just like a distributed elective, and I found it to be useful. One of the things that I think is really important, and for you all as you're going through your training, is that when you're not going to believe this, but 6 months ago, the big concern was physician burnout,
Uh-huh.
right?
Oh, well, yeah. I never heard of that before.
Yeah, so physician burnout was a big concern, but we go through COVID, and now everybody just wants a job, right?
Yeah, that's true. That's true.
And so, but pretty soon, it's not going to be long before, once again, physician burnout is going to be our concern.
I bet. I bet.
And my wife's a pediatrician, and she didn't get any breaks during COVID, and she still has a concern of physician burnout.
Yeah. You're just brown all over, I guess.
For me, it was that's currently not my concern.
Yeah.
But the idea, one of the things that comes with physician burnout is it comes from lack of control.
Sure.
If you read about physician burnout, it's like, well, one of the big things is, well, I don't have any control of my time. I can't even go to the bathroom. I can't get a cup of coffee. I can't go to the dentist.
Yeah.
And so that was one of the other things that we did this captainship time, because it just allows you to, if you want to go to the dentist, you go to the dentist, and
Yeah.
no one asks anybody what you do during that time.
Yeah.
I don't really care.
Yeah.
If all you do during that time is you watch cartoons or reality TV, which is what I would do
Okay.
during that time, and yet you're able to stay up later and do more stuff.
Yeah.
You're able to concentrate more. Well, that's what you needed, right? That's what you needed.
That's fair.
Anyway, so that's one example of something we've been doing to try to get at this issue of both burnout and also sort of trying to figure out how we can make physicians that don't get so squished and don't become so externally motivated
Mhm.
that when the time they come out, they're no longer leaders.
Sure. Sure.
And I'm sure you've noticed that, boy, in a lot of ways, as physicians, we've given it away.
Yeah.
There's administrators and there's nursing leaders
Yep.
running the show.
Yep.
And we're supposed to be running the show.
Mhm.
And so one of the reasons I think we've lost that is because we got it squished out of us,
That's fair. Yeah.
So anyway, that's probably more than you want to hear about that little story. But it's part of our culture and part of our what we're trying to do with our residents.
No, I mean, it sounds like you're trying to take care of your residents, and the residents are given their, the autonomy to be their own person when they have the time to do their own thing. And I think that's something a lot of, I can guarantee you a lot of students will ask you that, and whoever you does that interview will be looking for that. So I'm sure it's a big highlight of the program itself. And I think it's worth noting also that one thing we should mention is that you have a very famous alum who we all know pretty well, Dr. Glaucoma Flecken, who was at University of Iowa for his residency. So I'm sure he also probably used that time to do his creativity with his jokes or whatever he did. But there's people out there who went to Iowa who've gone on to do things like he's done, and I'm sure there's others out there who've had fantastic careers, and it's such a good program that whether you do fellowship or comprehensive, I'm sure there's a lot of options out there at Iowa.
Well, yeah, he was a great character as a as a resident. As long as he didn't latch on to you to make fun of him. As long as you keep a low profile so he didn't start making fun of you, it was good. But I love working with him. He talks a lot about in his tweets about his adventures with medicine, doctors messing with him.
Right.
And so yeah, he's been through it. He actually spoke at our graduation because there was a resident we had that had some health issues, and he wanted to you know, address her issues. So it's yeah, we really, you know, we really got into social media. We had a guy named who's got the site Steve Christensen.
Oh yeah, yeah.
So he came the same year as Will Flannery, and basically he got us turned on to Twitter. We were already pretty embedded with Facebook, and
Okay.
we around site, and we were doing a little bit of Instagram, not very much.
Mm-hmm.
But we really like our residents to get involved in social media, and so so that class also included Lori Provincial,
Uh-huh.
who also is she's the senior editor for ophthalmology for social media.
Yeah.
That class was a powerful social media class, and
Mm-hmm.
we all learned quite a bit from Steve, and then the two of them kind of went dramatically different ways.
Right. That's true.
Dr. Glockenflecken went sort of the humor way,
All
and
good.
then
Yeah.
Lori went the
Academic.
way of being the chief for the
That's
academy, a very, very traditional way. But both of them have had a profound influence on social media for ophthalmology. And
great.
then, so I mean, all three of them, I should say. But that's one of the things we have the residents very involved with our website called iRounds. And so I encourage, if you want to find out about sort of our portfolio of our program at Iowa, it's iRounds.org. And that's something that was started by one of our residents, Andy Doan, about 20 years ago, way, way long ago, before there was broadband, you know, coverage in most homes. And so we would worry about things like putting a picture in,
Uh-huh.
because, you know, we may not make it.
Sure.
And so one of the requirements of the residency is to participate in that.
Okay.
And so we have, you know, like a law school review. Or, you know, where there's a board for the law school that figures out how you publish. We have the same thing. We have an elected body of residents that run iRounds. We have faculty that are on the board, and so basically all the residents have to produce at least 3 cases, and the interns produce a bunch of pictures, and so it's really kind of the portfolio of our program. It allows us a opportunity for our students to publish on that.
Yeah. Yeah.
And if in a lot of subject areas, it's you know, 1 or 2, and it's on the front page of Google and so forth.
Yep.
But that you know, that sort of was the area that all of our social media was pushing people to, and so we have our residents participate in that, and then they learn about social media. I mean, I think it's important for them to build their own brand in addition to helping us with our brand.
Sure.
And that's what Steve, Will, and Lori and others have done. Prashant's another one that's very big on social media. And so I think we're doing a little bit of training in that area. And at least we're exposing everyone to that. So, well, listen, I better let you go. I mean, I can't believe anybody would sit through more than about 4 minutes of Tom.
Well, no, I wanted to give you a chance to really talk about what you felt was important about Iowa, and you've talked about so many good things. You've talked about the things that I don't think a lot of us knew about, the captain of your ship kind of days, and I think the camaraderie that you mentioned as a program director. It's important for applicants like myself to hear what's important in your point of view. So what do you're the representation of the program at the end of the day. So what you see as the priorities is something you would address, and I think that what we want to hear is the things that you talk about. And it seems like Iowa is a place where you can be your own person, but also fit into the picture of the ship itself. So I think we're all excited to see who's going to be at Iowa next year, and what you guys are going to do with the opportunity. I know that you've addressed some of the things that I usually ask applicants on previous podcasts of Dr. Jay Sridhar's podcast, Straight from the Cutter's Mouth, a retina podcast. I know that you just recently addressed a lot of the concerns that applicants may have. So for all the applicants out there, if you want to hear about Dr. Oetting's advice about how you should approach your application and what the program directors are kind of looking for in applications this year, you should listen in on that podcast, because I don't want to beat the horse again, but he's addressed it there. And as he said in that podcast too, I think we're all going to have different applications than years prior. So maybe we should just keep that in context. And Dr. Oetting, you're always welcome to come back if you want to talk more about Iowa, and looking forward to seeing what happens this year. Hopefully it's a year that changes education for for the better. And I think, like you said, I don't think virtual interviews are going anywhere anytime soon. I think we'll probably have a hybrid model of some kind. So hopefully this is helpful for you. It's helpful for me and other applicants, I'm sure. And we look forward to hearing what happens next.
Well, hey, thanks, Bilal. I really appreciate, and I just want to congratulate you on taking the bull by the horns and using this technology in a productive way and letting me talk about Iowa for a bit. And, we're looking for diamonds in the rough. We're looking for people out there with passion for ophthalmology. We're looking for people that want to be part of our team. Don't worry about Iowa. It's a great little town. Don't worry about the Midwest. You'll be fine. You're probably like most of our residents that don't want to leave after they come.
Sure.
And then we if you don't come for residency, think about us for fellowship. We have 10 fellowship slots, and so we really would like to to get to know you better. So thank you so much, and I look forward to seeing you on another Zoom in the future.
Yeah, let's hope so. And if you want to follow Dr. Oetting, you can follow him at Cataract Guy on Twitter, at Cataract Guy, not to be confused with at Cataract MD, which is Dr. Gary Wirtz. So that's where he's on Twitter. You can follow him there and maybe learn more about Iowa. And you can follow the University of Iowa at UIowa, and I'll make sure I tweet that out properly if I messed up this time. So make sure you check out what's going on in Iowa to all my listeners out there, and we will see you on the next one.
Thank you.